Hello everybody. This week is National Engineers Week, and also this week we have International Women's Day. So I am just delighted this week to be joined by a biomedical engineer who's all the way originally from Russia, Moscow, and is working in our Faculty of Science. So Karina, you are most welcome to be my guest this week.
Thank you very much, Huna. My name is Karina Litvinova, and I'm just started an NTU, very new one. This is my 4th month, so happy to be here.
Delighted, and colleagues were telling me about you and so fascinated with your background and what you've done. So tell us particularly about the research you do, Karina. What areas are you covering?
Well, I was born as a scientist at the Institute of Biomedical Problem, Russian Academy of Science, and this institute specialized in space medicine. And this was the first time when I met the lasers. And I'm a laser. I'm full in love in lasers. All my life, I'm more than 15 years in my research. I developed the laser-based techniques for the clinicians. And we started with wearable devices, diagnostic devices, and now we are more clever, and our group is growing, and we are now assist the clinician in during the transcatheter procedure and additional treatment. For example, we could weld the tissue without any stitching materials or without just use the laser and diagnostic tools. That's it.
Fantastic, really fascinating. So I know you've brought an example with you here, an artifact, just to show us, explain how this works and what does it do?
Yeah, this is one of the project. We call this project Deep Smart Light, and this is highly accurate cancer detection. We successfully tested this device on to detect and classify skin cancer. Particular, this is melanoma and basal cell carcinoma. Here is one of the example of clinical trials in Nanwell Hospital in Scotland. So the procedure is super easy. So you just apply the optical probe on the surface of the skin, and you receive the classification of this is a skin scanning area. This is without any extra sign or something like that. This is just a normal skin without anything, and you receive the results just on this display. And if anything wrong with the mold, for example, usually I present it like this. I put the fiber on my mold and test that this is a standard mold without any changes. But it's super cool that I could monitor. If something happened, immediately I can go to my doctor and ask, oh, could you please remove, because this is something wrong. My device showed this one. Yeah, this is how it's work.
Fantastic, really, really fascinating. And it's all light waves you were explaining to me earlier. Photonics, that's the technology and how it works.
Yeah,
amazing.
This is just the most expensive thing from this device. This is optical fiber. Inside this fiber, this is 120 fibers combined just in one simple optical probe to collect the best signal and to scan more area. We call this also like hyperspectral imaging. This technique was cropped the idea from the NASA.
NASA? Wow.
Yes,
wow.
When they're scanning the surface of the Earth and trying to find any fossils or oil, and this is quite similar idea what we presented to the clinician and started to adapt this to the clinical needs.
Isn't that just amazing? And you can see your passion for the whole laser technology. And for colleagues to know that Karina has, how many patents now have you got?
Successfully granted, it's 5.
Fantastic, that's amazing. And you were just telling us about this project, the award you won. So tell colleagues about that, for what you won in the UK for the project.
Oh yeah, this is our second project.
Yes.
So we call this project Cardiovascular photonics. On one side you could see this is normal heartbeat, on other side this is abnormal heartbeat. And catheter ablation, this is a standard procedure which surgeons do in catheter lab to bring the heartbeat into the normal condition. And during the conversation with the clinician, they told me that unfortunately this is quite useful procedure, but they're really blind during all this transcatheter procedure. And how to resolve this problem? A lot of catheters, they have like sensors, temperature sensors, which could help them to control the lesion size, but unfortunately all of these it's not give them information that the procedure was made successfully. For this reason we combined our device with the standard catheter, and for this work I was nominated for 50 million in engineering in UK in 2021. And yeah,
that's a fantastic achievement, and I love it's the combination of science and engineering all coming together.
Yeah.
And that's, you know, biomedical engineering, your background. So congratulations for that. That's
Thank
some
you.
achievement. I think we're so lucky to have you here in Sligo. So I'm going to finish by asking you to, maybe you'd like to tell us a little bit more about yourself. Anything in particular you'd like to share with colleagues?
Again, I'm just started trying to figure out myself, my family, but I could say that, for example, I am a mom, and it's quite hard to find the balance between family and work, and it seems to me that the Sligo is just a great place for this.
Fantastic, and I'm sure you look forward, if you meet colleagues in the corridor, they'll know Karina now, and they'll, you know, invite you for coffee, have a chat, tell you about even more things that we have on offer here in Sligo. So Karina, thank you so much for being my guest this week.
Thank you. Thank you.